The Hampton University Proton Therapy Institute. 85 million pounds of concrete, 430 tons of steel, and all heart. It's the largest freestanding proton therapy facility in the world, harnessing the power of protons to target cancer tumors with pinpoint accuracy. Unlike traditional radiation, which affects both healthy and diseased tissue in its path, protons release their power in exactly the right place, leaving surrounding healthy tissue largely undamaged. Medical Director Dr. Christopher Senesi explains.
And the jump to protons is the first and major change in radiation therapy delivery that has happened in my lifetime. There are cancers in parts of the body that are so difficult to reach with standard X-rays that we really only have a proton option. When you don't irradiate the sensitive surrounding normal tissues, you drive the side effects down. And that's what all the excitement is about. It's the prospect for higher cure rates and less side effects.
You come out here and you don't feel tired, you feel nothing. I mean, you can't explain how incredible it really is.
Hampton Roads leads the nation in prostate cancer fatalities. With early detection, proton therapy offers a treatment option with few side effects.
It wasn't disruptive to my lifestyle at all. I was usually in here about 9:30 and probably about 9:45, I'm walking out to head back to work.
Proton therapy is also becoming a treatment of choice for pediatric patients whose rapidly growing tissue is more subject to injury from radiation. Oncologist Dr. Alan Thornton has 20 years' experience in proton therapy.
He's a nice dude, you know. He tells me everything. He tells me, you know, about what's going on in me. And, you know, he's a great guy. Is that my brain?
That is your brain.
No, talk about on the right side. What is that?
Oh, that's your ear.
That's your ear.
I enjoy being able to translate relatively complex issues to patients and explain it to them in a format that they can understand.
This is as if I was looking at your brain from below, Griff. So you're laying on the table with your feet out, and I'm looking at you from your feet up.
Many of the tumors with the children that I treat, I'm able to give a higher dose than I could with conventional therapy, and that translates into increased cure for these children.
Here's the little area where the tumor used to be, right there.
Our staff of physicians, scientists, and radiation therapists share years of experience in radiation, physics, and oncology.
Everybody knows that we're treating patients who have dreaded disease. They look at it with fear and anxiety when they come here. So our mission is to make sure that they feel as comfortable as they can when they come here and get the best care that is possible. We like to say it's a team effort, and we're here to make certain that the patients get the best treatment that can be given.
We bring with us a great deal of experience and knowledge of much of the research in this field that's being done not only in North America but also in Asia and in Europe, which is important to realize.
The caring and support we offer patients and their families is reflected in the center's spacious and sunny architectural design.
Everybody was compassionate. Everybody had charisma. And I mean everybody across the board.
The patients and the staff too. They become friends and people that you really value knowing.
Hey, handsome, how are you?
As soon as you walk in, it's, hey, how you doing? Like Mary Beth, she basically became like my mother here.
The Hampton University Proton Therapy Institute is about more than treatment.
We're going to get you right back in here into a dressing room. Thank you.
It is a center for research by scientists and health professionals to expand cancer treatment and develop new technologies. Dr. Cynthia Keppel is scientific and technical director of the Institute and endowed professor of physics at Hampton University.
This is the highest end of cancer treatment, and it's only going to stay the highest end if you continue to move it forward. So we want to, for instance, expand proton therapy beyond the traditional prostate pediatric and out into other kinds of GI, breast, lung. To do that, sometimes we have to introduce new technology. So we also are having instrumentation development. We've taken on a large challenge here where we have technologies that really don't exist anywhere else, and we're attempting to integrate them in and bring these to the patients.
Hello, my name is William Harvey, and I've served as president of Hampton since 1978. Over the years, we've harnessed the passion and dedication of so many of us to create new visions and new opportunities. The Hampton University Proton Therapy Institute is serving as a catalyst for new scientific discoveries and advanced care for cancer patients. As we work together to save lives, ease human misery, and advance medical knowledge, we build up our university, our community, and our world.
You know, most often when I do video roll-ins, they're about 2.5 to 3 minutes long. But because of the prominence that this facility has nationwide and indeed worldwide, and because it is something that the proton therapy just became available to folks in, was it October 2010?
Yeah, September 2010.
Yeah. Because I know that for myself, I opted to have brachytherapy because it wasn't available. But I wanted to take the time to show folks this video to let people know that proton therapy is indeed available and to give them a greater in-depth look and understanding what it involves. It is an impressive facility. Can you tell us a little bit more about it? How many proton therapy facilities are there nationwide, and on an average, how many patients do you see in a year?
Sure. Well, currently there are 10 proton therapy facilities in the U.S. When we opened in August of 2010, we became the 8th facility, and after us, 2 other facilities opened in Chicago and in New Jersey. We're currently operating with 4 of our treatment rooms. At full capacity, we'll have 5 treatment rooms, and we're able to treat about 65 to 70 patients per day, and at
per
full
day, really?
per day.
Okay.
So at full capacity, we'll have, like I said, 5 treatment rooms, and we'll be able to see nearly 2,000 patients per year.
So it opened in August 2010, but when was the first patient seen? We're going to come to you in just a second here, but when was the first patient seen? Was that in
September the 1st?
September the 1st.
September
That's the way
the
to
1st,
begin at the beginning of the month. Now, what different kind of cancers do you treat there?
Okay, well, we're able to treat prostate, head and neck issues, pediatric cancers, liver, pancreatic, breast, and also brain cancers as well, among other cancers.
Now, the material that you sent me in advance of the show, there's a reference to a gantry treatment room and a fixed beam treatment room, and we're going to be able to put the pictures of those up on the screen in just a moment here, but can you tell us about those? Because that's the 5 treatment rooms that you're speaking about, but can you tell us a little bit about them as we put the pictures up on the screen? The first one is the gantry room.
Okay, sure. Well, we have 4 gantry treatment rooms, and what's so special about the gantry treatment room is that the patient is lying within an apparatus that weighs 90 tons and is actually 3 stories high. They don't know it because
3 stories high?
3 stories
and
high.
90 tons.
Right. They see a false wall, so they don't see what's behind that wall, but it is actually a Ferris wheel-like apparatus that we call a gantry, hence the name, the gantry treatment room.
I see. And then the other one is the fixed beam treatment room.
Right, fixed beam treatment room. And the difference between those 2 rooms is that the fixed beam, the nozzle is just fixed and stationary in the wall. It doesn't move.
You know, when I got the tour of the place, I felt that I was walking onto the deck of the Starship Enterprise. It's amazing.
Yeah.
Now, Ronald, if you don't mind my asking, what kind of cancer did you have, and when were you diagnosed?
Terrence, I had prostate cancer. I was diagnosed in, excuse me, in October of 2009.
9, was it?
2009.
Okay.
I was due to have a week away from having surgery in January of 2010, and a friend of mine told me about the proton cancer facility being built out there at the time, and asked me if I would check into it, which I did, and call my cancer patient navigator, who in turn called the surgeon, and he said no problem, I would be a perfect candidate for proton therapy. He in turn arranged for appointment with Dr. Senesi, and I had several consultations with Dr. Senesi and went on from there.
Well, Dr. Senesi, as I shared earlier, was my own radiation oncologist.
Yes.
Now, what was the experience like with the proton therapy? What was that whole experience like? Can you describe the process?
Well, I've had no side effects. I feel absolutely fantastic. It didn't jeopardize anything of my daily living in any way whatsoever, or any activities whatsoever. I termed my experience as the incredible journey, the adventure of a lifetime, and it truly has been, because and it's something that I would never ever regret. You know, I would do it over again in a million years.
So, Rita, that sounds like something you should put on the bottom of of your spouse, an incredible journey and adventure of a lifetime. Very well said.
And it also, you know, the daily process is going out there 5 days a week. The treatment itself is 20 or 30 minutes long, getting situated and all that. The actual treatment takes about a minute or two for the beam to be, you know, initialized and all that. So.
I was talking to one of the videographers here. I won't mention him by name, but he mentioned his father, who had just finished a couple of months ago with proton therapy, and they thought he was going to have 45 treatments, but because of the efficacy of the process, it only needed 30. How many treatments did you have, and when did they begin?
Mine started September 1st of 2010, ended November 2nd of 2010, and I had a total of 44 treatments, which is fairly standard, but everything is individualized, so some people may have less than what I had, but the standard for prostate cancer is usually 44 treatments.
Do you remember your prostate-specific antigen level, the PSA level, what it was prior to and after the procedure?
My PSA level at the time was 3.65, which was not really alarming, but my I went to my urologist. My prostate was enlarged, so therefore he took samples and found out that, yes, I did have cancer. And that's back in, like I said, in 2009, October 2009. Then it has significantly dropped down to 0.4, 0.5, 0.71, and which is fantastic for after the treatment. And it's going to fluctuate for the first year when you do have proton therapy, what they expect, because then that way it will establish a baseline for them to go by as to what your prostate, you know, the PSA is going to go in the future.
That's why early detection is so important, because it gives you so many more options. When I was diagnosed, my PSA was like at 2.8, and again I had the brachytherapy, the insertion of the radioactive seeds, and it does in fact bump, because the my latest PSA was 0.45. Previous to that, it was 0.25. So it bumps, and you know, so they're going to be able to keep where it is going to be the maintenance level where it's going to be.
Right.
So I wanted to ask you the advantages of proton therapy. Now, he spoke with minimal side effects, and I shared with you before we began taping here that I did experience some side effects. You know, I like where my PSA level is, but I experienced some issues. What are some of the advantages of going with proton therapy?
Okay, well, proton therapy is a form of cancer treatment that is able to target the tumor precisely. It is a form of radiation that can actually be configured to the exact size and shape of the tumor, and what that translates for the patient is reduced side effects, as Mr. Cosman explained. Every patient will have a different experience, but for the most part, it translates to a reduction in side effects for the patient. And to date, over 100,000 people worldwide have received proton therapy.
100,000 people. Now, of course, with radiation therapy, traditional radiation therapy, that there is some tissue damage versus proton therapy. Now, explain this to me, and I may be mistaken, but I think that with the proton beam, you can target it for a specific area, which minimizes damage beyond that point.
Right.
That's amazing. That's amazing. So it is like the Starship Enterprise, right? Beam me up, Scotty. Let's see here. I want to make sure I get all of these questions, and let's paint a typical statistical portrait of prostate cancer, and indeed the incidence of cancer statewide. And the reason I want to do this is that Hampton Roads experiences the highest fatality rate of prostate cancer in the nation.
Right.
But a lot of folks are unaware that African American men have the highest rates of prostate in this area. Have the highest rates of prostate cancer in the nation. Some people arguably say the world. Can you give us some other statistical data about cancer, whether prostate cancer or not?
Sure. Well, that is actually true. According to the American Cancer Society, African American and Jamaican men lead the world in prostate cancer incidences. And, so what that means is, African American men especially need to stay on top of screenings and so forth. Men in general as well, because it's so prevalent, the incidences of prostate cancer, not just in African American, but especially so. But cancer in general is the second leading cause of death. And
that's in men and women?
That's in men and women. And in women, it's the leading cause of death from ages 40 through 79. And in men, it's ages 60 through 79 is the leading cause of death. But as well, 1 out of every 3 Virginians will develop some form of cancer in his or her lifetime.
Wow. Now, Ronald, you look as though you just graduated from college. Might I ask, how old were you when you were diagnosed, sir?
I was 63.
Was there any family history?
Yes, my father had prostate cancer, and he was treated with the traditional radiation, which, he wound up getting burnt and things like that by the radiation and all that, and had several problems after that. So, I really didn't want to go that route. But
it's incredible, and I would say a blessing, just personally speaking, I would say it's a blessing, that you were able to do this like a week before you were scheduled for surgery.
Yes, sir. Yes, sir. The surgeon said he didn't have any problems with it. Like I said, he was good friends with Dr. Senesi, and he says, don't worry about it. We'll cancel the surgery and go and have proton therapy. And so I had his blessing and all that. I did have to have, however, a Lupron shot about 2.5 months prior to starting my treatment.
I'm sorry, what was that again?
A Lupron shot, which is an anti-hormone shot, which causes the prostate, since mine was enlarged, which causes the prostate to shrink, and the cancer cells become more susceptible to the radiation when you do start your treatments, which were fantastic. But it also throws you into male menopause or hot flashes, so I can sympathize with all women that have hot flashes.
Well, I think men go through menopause too.
Yes.
That's why they call it menopause.
Right.
And as we're talking here, I just realized why I keep making these repeated references to the Starship Enterprise. Dr. Senesi, when he's talking, He reminds me of Carl Sagan talking about the cosmos. You know, he's just so very, when he's talking about proton therapy and indeed about prostate cancer, because he was my oncologist. He is just so well informed. So absolutely well informed, and I think that I'd love to have him come on to the show at some point. You know, we tried to do that before.
Love to.
Yeah, I would definitely get him back onto the show, or get him onto the show. Ronald, for those people that are contemplating, that have been recently diagnosed, and they're looking at the options that are available to them. Now, we've heard the statistical, well, we've heard the advantages that proton therapy offers. But from your personal experience, why would you recommend proton therapy versus brachytherapy or external beam radiation?
Well, it's less invasive. It doesn't affect your activity like regular chemo and radiation would. And definitely, if you had the total prostatectomy, that definitely would interrupt all kinds of activity. And the side effects after those, I wouldn't want to go through. But like I said, I've had no side effects whatsoever. Didn't affect my daily activity. I was able to go do whatever I wanted to, and I go out there frequently, to about every day, to the proton therapy and talk to future patients as well as current patients to, for the new patients, take some of the stress and anxiety out of what they may go through on a daily basis as a patient, and also talk with the current patients to see if they're having any problems or any side effects. And it's a fantastic camaraderie that you develop with all the patients out there. I may not remember all their names, their faces are familiar, but when you're dealing with almost 200 patients that have gone through there, then it's a little difficult to remember some of their names. But I work very closely with Francine Staten, who is the patient coordinator out there. She lets me know when prostate patients are going to be out there, so like I said, come out there and visit with them and answer any questions from a patient standpoint that they may have, any questions they may have for me to answer or whatever. I, by all means, don't give any kind of medical advice because I'm not qualified to do that.
But you make for a fitting ambassador for the, I won't say HOOPTI like I always want to call it because of the acronym, but for the Proton Therapy Institute, and also as the very first patient to ever receive care there. Before we run out of time, we're going to have a little bit of time here, but I want to make sure we give contact information for our viewers who would be interested in getting out to the Proton Therapy Institute. How can folks get in touch with you or the Institute?
Okay. Well, to reach us by phone, people can call 757-251-6800 or access our website at hamptonproton.org.
hamptonproton.org.
Right.
Now we don't have it on the screen, but could you just give us that Facebook and Twitter? Who manages that Twitter account anyway? But I'm sure that's probably you. What is the Facebook address? They can be reached. You guys can be reached on Facebook as well.
Right. Facebook.com/HamptonProton, and that's the same for our Twitter page as well.
Hampton
Proton. And we manage it in the PR department.
In the PR department. So you just a little Twitter. I've never done Twitter.
Really?
Yeah, I'm a twit. What is a twerp? So because I haven't done Twitter. So how did it feel to be the first patient there?
Oh, it's distinguished honor that no one could ever imagine. Being having great interviews such as yourself, and being in the newspaper, and being able to go out and reach all kinds of patients out there, not only prostate cancer patients, but other type of cancer patients, and it's really been a great enlightening experience. And like I said, I would never change it for the world. I look forward to, expanding my ambassadorship, so to speak, to, be out there and learn more and more about, as we progress with new types of cancer, being out there, how they treat them, and all that type of thing.
So they haven't called you an ambassador yet? That's something that you need to fix. Ronald Cosman, Ambassador, Hampton University Proton Therapy Institute.
There you go.
I want to thank both of you for coming on today. We've covered a lot of information, and I think for those viewers out there, because there are going to be people out there with not just prostate cancer, but some of those cancers that you mentioned that are going to be interested in the proton therapy. So again, thank you so very much for coming on.
Thank you.
I also want to thank our students, yourself as well, the students from the Television Entertainment Group that have joined us today. And I'll see you guys in class tomorrow evening. But by the time this gets on the air, though, the class will have been over. And most importantly, we want to thank you for joining us today for this edition of Health Watch. And remember, you can watch previous editions of Health Watch online. And if you'd like to drop me a line, you can reach me email me at terrence.afferanderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836, 757-683-8836. Now, if you want to get to us online, that's norfolk.gov. www.norfolk.gov. For the Norfolk Department of Public Health, I'm Terrence Afferanderson, and this has been Health Watch.